In the world of medicine, every single decision can literally be a matter of life and death. I mean, you can imagine the pressure, right? The stakes are just astronomical, and a lot of the time, the information is incomplete. So the big question is, how do doctors even begin to navigate this landscape of uncertainty? Well, that's what we're going to dive into, the incredibly complex world of clinical thinking.
So, let me ask you this. When you picture a doctor, what's the first thing that comes to mind? What do you think is their single most powerful tool?
Maybe you're thinking of a surgeon's scalpel, all gleaming and precise. Or maybe it's that trusty stethoscope, the symbol of the whole profession. Or, hey, what about one of those huge multi-million-dollar scanners that can literally peer inside the human body?
Well, as it turns out, the real answer, the most critical tool in any doctor's bag, is their own mind. Yeah, that 3 pounds of matter between their ears. It's the complex, absolutely brilliant, and let's be honest, sometimes flawed thinking process that drives every single diagnosis and every treatment plan.
But here's the thing. That brilliant mind is operating under some serious pressure. And one of the biggest challenges in modern medicine is this intense focus on the immediate acute problem. Kind of like the tip of the iceberg here. The whole system often pushes for quick fixes, right? And that can mean the deeper chronic conditions lurking just beneath the surface get overshadowed. All that pressure, it can fundamentally change how a doctor thinks.
And that's why mastering that thinking process is so absolutely key. It's not just about cramming your head with more information. This quote from John Dewey, way back in 1910, just nails it. The real goal is learning how to think, not just what to think. And really, that's the absolute core of effective clinical reasoning.
Okay, so if the goal is to get better at how we think, the first step is to actually understand what's going on up there. And for that, we can turn to a really powerful model of how we all think, not just doctors. It's called the dual process theory. The easiest way to think about it is like this. You've got 2 different operating systems running in your brain. One is built for pure speed and efficiency, and the other one, well, that one's for deep, careful, methodical analysis. The real art of medicine isn't just having these 2 systems. We all do. It's developing the awareness to know which one you're using at any given moment, and, crucially, when it's time to switch.
All right, so let's break them down. System 1, that's our default mode. It's fast, it's intuitive, it's all about pattern recognition. Think of an expert ER doc making a split-second diagnosis. That's System 1 in action. Then you have System 2. This one's the polar opposite. It's slow, it's deliberate, it's analytical. It burns a lot more mental fuel, but it's absolutely essential when you're facing those really complex, unfamiliar cases.
But here's the catch. Relying too much on that fast, automatic System 1 thinking, well, it can lead us right into some very predictable traps. In psychology, these are called cognitive biases, and in medicine, they can lead to serious diagnostic errors.
So take anchoring bias, for instance. This is where a doctor might grab onto the very first piece of information they get, say a patient's age, and just let it totally color their entire diagnosis. Then there's confirmation bias, where they might start, maybe subconsciously, just looking for evidence that backs up their initial hunch. It's the classic case of only seeing what you want to see.
Next up, availability bias. This happens when a really recent or dramatic case is just front and center in a doctor's mind, right? And that makes them way more likely to diagnose that same rare thing again, even if it's not a great fit. And then there's premature closure. I mean, the name says it all. It's literally jumping to conclusions, settling on a diagnosis before all the evidence is in, and closing the book way too early.
And believe me, this list goes on and on. You've got things like affective bias, where a doctor's personal feelings about a patient might cloud their judgment, all the way to groupthink. In fact, researchers have identified more than 40 of these different biases that can trip up clinical reasoning. It's like a minefield of mental shortcuts that can lead even the very best doctors down the wrong path.
So if our minds are this fallible, what do we do? How do we protect against these kinds of errors? Well, we build better tools. And I'm not just talking about physical ones, but cognitive tools, things that give us objective data and structured guidance to lean on. A perfect example of this is something called procalcitonin, or PCT for short. It's a pretty simple biomarker you can measure in the blood. Now, here's the cool part. Its levels shoot up when there's a bacterial infection, but they stay low with a viral one. Just like that, doctors have a powerful, objective clue to help guide their thinking.
Now, what's really interesting about this slide is just how clearly it lays everything out. You can see right here, as those PCT levels climb from basically 0 all the way up to over 10, the patient's condition gets progressively worse, from healthy to a local infection and all the way to life-threatening septic shock. It gives doctors a super simple, at-a-glance guide to how severe an infection really is.
And this is how that data gets put into practice. Simple algorithms just like this one act like, well, like cognitive guardrails. They don't replace a doctor's judgment, that's super important, but they do help prevent biases like commission bias, which is that tendency to just act, just in case. By giving clear thresholds for when to use antibiotics, it helps make the decision a lot more objective.
And if you look ahead, these cognitive guardrails are only going to get more and more powerful. Take something like precision medicine. This is all about moving beyond that old one-size-fits-all approach. Instead, it gives doctors incredibly specific data based on a single patient's unique genetic makeup and lifestyle. This is huge because it helps cut down on the guesswork and reduces the risk of biases, like anchoring on what's true for the average person instead of what's true for the individual right in front of you.
All of this really brings us to a fundamental truth about medicine. For all our amazing science and all the data we can gather, it's never going to be a field of absolute certainty. It is, and it probably always will be, a practice of managing the unknown.
So, the really crucial takeaway here is this. The best doctors aren't just masters of medicine, they're masters of their own thinking. And this gets back to that awareness we talked about earlier. There's a name for it, metacognition. It's the ability to kind of step outside yourself and think about your own thinking. To recognize when you're coasting on that fast, intuitive mode and realize, hey, maybe it's time to hit the brakes and deliberately switch over to that slower, more analytical system.
I mean, this quote really just says it all, doesn't it? The ultimate skill for any doctor isn't just knowing all the science. It's about embracing the art of medicine, the art of making the best possible decision with the information you have, all while having to deal with this profound, ever-present uncertainty.
So I'll leave you with a final thought to chew on. In a world that is just overflowing with data, from biomarkers to entire genomes, what's our greatest tool? Is it the test itself? Or is it the human mind that has to learn how to wisely and humbly interpret it all?